to rule out the possibility that the pregnancy rate declined because the residents of Genesee County were having sex less often, Grossman and Slusky consulted the Bureau of Labor Statistics' American Time Use Survey, which reported that sexual activity in Flint's Genesee County actually increased in this time period. The survey reports on a range of time uses including personal or private activities including having sex, making out, cuddling partner in bed, and spouse gave me a massage. While this is only suggestive evidence, they write, it supports our conclusion that the reduction in the conception rate is not driven by a reduction in sexual activity. The research also found that babies born in Flint after the water supply changed were 150 ounces, lighter, and gained less weight than babies born in other parts of the state. At least one other study found similar impacts from widespread lead pollution in Washington, D.C., from 2000 to 2003. But Grossman and Slusky admit that the effects of lead in water on fertility and birth outcomes are not well established. The magnitude of the effect seems higher than what I would have expected, but this is why we do science, Edwards continued. Our expectations are very often wrong. Grossman and Slusky bookend their findings with references to a draft of the Trump administration's 2018 budget proposal released in May, which seeks to cut more than $5 billion, or 31%, of funding to the Environmental Protection Agency. This study is of great importance as the current legislative environment includes calls for a substantial decrease in funding for the EPA, which is charged with ensuring localities maintain minimum water standards, the authors write in their conclusion. Our results suggest that a more lax regulatory environment in the context of drinking water may have substantial unforeseen effects on maternal and infant health, including large reductions in the number of births. Even under the Obama administration, though, the EPA failed to prevent the Flint water crisis. Since Ms. Hedman resigned, I have only positive things to say about the performance of EPA R5, Virginia technicians, Edwards told NewsPulse News via email. While reasonable people can differ about priorities for spending, budget cuts will most certainly not help EPA fulfill their important mission. Though EPA Director Scott Pruitt has denied plans to close specific regional offices, reports that Region 5 could be shuttered under Trump's proposed budget has sparked backlash from a bipartisan coalition of Michigan lawmakers, including Republican Representatives Fred Upton and Mike Bishop, Representative Dan Kildee, a Democrat from Flint, and Democratic Senator Debbie Stabenow. This latest report is truly heartbreaking, Stabenow said in a statement to NewsPulse News. This is another terrible reminder of how the water crisis has hurt residents in Flint. Grossman urged the significance of the study's findings in light of current threats to the EPA. The reason we were able to do this study is that other researchers learned of the high rates of lead in the water, he told NewsPulse News. One aspect of the proposed cuts to the EPA is to cut areas that are charged with testing water for contaminants. With fewer resources, areas may not know that their water source is contaminated, which can have serious consequences, as our current study reports. This January, nearly 3 years after the city began pumping water from the Flint River in an effort to save money, officials finally declared that the lead in the city's drinking water had declined to below the legal limit, though many residents remained skeptical. A total of 15 state and local officials have received criminal charges in relation to the water contamination crisis. 5, including the head of Michigan's health department, have been indicted for involuntary manslaughter in the death of one of 11 people who died in an outbreak of Legionnaire's disease attributed to bacterial contamination of the city's water supply, a problem related to, although distinct from, the lead pollution.